So what we are going to discuss today is something that's very close to the foundation and to me as well personally. It's about how do we sort of integrate livelihoods and health and nutrition together, right? More so as you work in the communities, we are realizing that both are intricately linked and sort of impacting the community in both ways. So that's something that we're looking at as organizations. How do we sort of go forward working in this space? How do we ensure that the community is getting the right sort of intervention, and we are able, as organizations, we are equipped to deliver better, right? So I think this conversation is structured around that. I'll not take more time. I would love to, we would like to keep this engaging, so we'll have, we want to keep more time for you to ask questions to the panelists and also have a good discussion with the other group of, with our entire pool of people here. So without further ado, I'll invite Rashmi, who's a moderator. Rashmi is the CEO of Harsha Trust, so welcome Rashmi. Thank you for coming, Executive Director, sorry. Yeah. Next, we call upon Dr. Indrani Bhattacharya from Cine Child in Need Institute. Welcome, Dr. Indrani. Ronak, welcome to you as well. And Saikat Pal from Rajarhat Prasari, please. Sorry, my apologies. I think Sarthak, we'll figure this out. Let's move to the slide. Yeah, that's okay. Great. So over to you, Rashmi. Yeah, sorry. I'll just make one. Sorry. Yes. Yeah. So we also, as you would have seen in the agenda, we had one more panelist, Dr. Chengma. He couldn't be here with us due to bereavement in his family, so we apologize. He kind of wishes us good luck and all the best.
Thank you. Thank you very much, Solomon. I think the topic that what we have for this session is a very pertinent topic, and kind of panelists that what we have, I think a great panel where we have Seva Mandir, Ronak from Seva Mandir, an organization which is more than 50 years old, done wonderful work in a very concentrated geography, responding to the needs of the community and evolved the organization. We have Saikat from a hardcore livelihood promoting organization working on the issue very, very intensely on livelihoods and water and how the organization has evolved, layering various interventions. We have Indrani from Cine. Cine is a pioneer organization, be it the NRC work, which Cine had demonstrated to government, be it the nutrition mix. So I think a lot to learn from Indrani. So welcome all of you. Just to set the context, I think the NFHS 5 data shows that still there is a very high level of malnutrition. And in fact, some of the trends that are coming, that there's a growing obesity, there are NCDs coming up very high. There are new sets of health issues are emerging in the areas, be it rural areas, the NCDs, the blood pressure and the hypertension and the diabetes are also, if you see the percentage are growing. There are a lot of kidney failure, unknown reasons that are coming up, unknown diseases are also coming up. We also see climate change is also bringing up a lot of health issues, be it heat, be it continuous cough because of pollution. So there are many health issues are also emerging in rural India. And we also know that, like for example, the issue of malnutrition, if we don't work on the initial 1,000 days, is actually irreversible damage that has been done to the child. And that has an impact on the productivity and the overall livelihood. So there is a deep connection between livelihoods and health and nutrition that we see on the ground. So great that we are having this panel. So let's start this discussion. We'll have 2-3 rounds of discussion. I'll begin with Ronak. I request Ronak to begin. As an organization, Seva Mandir, as I said, that it's an organization which is very community-centric, identified the need of the community, and designed the programs. So how, I request you to talk about Seva Mandir's journey, the evolutionary journey, how the organization has evolved, and why did you choose to layer these two interventions, and how do you see this nexus of livelihoods and health and nutrition? Just on it's working. Say it.
Hello. First of all, thank you very much, Dhruvi, Harsh, Solomon, for this journey of integration started Seva Mandir very deeply with Axis Bank Foundation and Caring Friend project. So that's the first thanks, and then second for inviting us to share our experiences here. As Rashmi told, Seva Mandir, we work in South Rajasthan, which is a tribal hilly belt, and very concentrated in the southern Rajasthan belt with about 3 to 4 lakhs families. So that's been our place where we learn, and we have done large amount of work. So livelihoods, Seva Mandir's work is on comprehensive development. So for many years or decades, we have been working on livelihoods and health and nutrition, but they were separate for a long time. They both started as a program, as a need of communities, and each of them in itself became a large program for us. We ran our own preschool centers, work on maternal health care for a long time, training traditional birth attendants for safe deliveries, also work on home-based cares for children, and hygiene and waterborne disease was another important area. Simultaneously, for livelihoods, farm-based livelihoods, common lands, restoring forest-based livelihoods have been also long-standing program. And sometimes some villages, some communities, they overlapped. But it was never kind of a structurally overlapped. They overlapped by chance when both these needs arise, and we start working on them together. But it was never like that we had made this two intervention done simultaneously in this area. So how this changed for us? We've been kind of seeing for a long time that, and most of the livelihood organizations, that in last 10-15 years, when we do livelihood program, men will come in the training program, but when we go in the farm, women will work. So that, and it's a known for all the organizations. I'm not saying anything new. So then we started focusing on women farmers, and that became our first point to start thinking about integration, and I'll tell how it happened. But this women farmers centeredness approach was the driver for Seva Mandir to get into more integrated approach for livelihood and health and nutrition. So when we started digging deeper on our own evidences or data, what is happening in our livelihood program, we realized that the rise in income was not having any connection on change in nutrition or food habits at home. Money was being spent largely on either repairing of households, weddings, or even buying assets. But there was no kind of use of that money for changing the food basket. At home, large food will increase, starvation will go down, to large extent, but cereals and pulse will be largely added. But no addition of animal products, vegetables and fruits. So we started kind of wondering that when we are working so much on livelihoods and we are saying that income will go up, it will change the household well-being, but it's not been there in the data which we are seeing. So that was one clear thing for that. An assumption of that rise in income will convert the health status in the families is not obviously happening. And I think there are now a lot of studies which shows even developed states in India, this relationship is not visible in terms of nutrition. If you look at even more high income states, there are pockets in each state where even though income has gone up, nutrition level or health status has not gone up. So that was another reason we realized that we need to work on some system change or some way of working for us. And then we started working on our integration model. Our approach of integration, we look at women. Children was part of the women life, but we started looking at women, and we looked at health at two levels. One, as women as an individual, her own need. In that also three major areas. One, her own health problems, so anemia, what she's eating. Because if you want to work in farms, you have to have your own health well. So her workload is already much higher, and then we are adding a livelihood activity, and she's not healthy enough to it. So what she's eating, how that can be changed. The second part for women was her physical drudgery. Where do we reduce the physical drudgery? Because that was training her in her physical health. So collection of drinking water, collection of fodder, and collection of fuel wood. These are three main areas where women physically work a lot, and that also impacts her health. And third is violence. When a woman is suffering domestic violence, mental health it's also affecting the livelihood. So that was the level of women as an individual. And then the second part as her role of family health, her responsibility of managing the family, which again had three areas. One was getting clean drinking water. While you get the drinking water access and physically, but if you don't get clean water, there will be somebody falling ill in the family, and again the load comes on women, and her work on livelihood gets affected. The second role was nutrition of her child and child care. Like urban, we have a lot of child care centers. We don't look at our Anganwadis as an important service for working women in villages. All of them are working women, but the child care service becomes an important facility for family. And third, what is a food basket collect in her entire family, what she is eating, but also what she's feeding, the child is being fed and other members. So that's the way we started looking at our approach, and that's been now more. I can come back later on more specific points.
Sure. Thank you so much, Ronak. I think very explicitly you said that enhanced income doesn't automatically transition to the improved nutrition at the household level. I think it's well said about that. Also, you spoke about keeping women at the center has been your key focus area, key approach at her own individual health, and also her engagement in the family house, be it clean water or child care and child nutrition, and of course the food basket. So thank you so much, Ronak. Saikat. Saikat, if I talk about Prasari, so Prasari is an organization which is working very deeply into the issues of water, livelihoods, strong community institutions that you have. Why did you get into layering of this intervention, livelihoods and health nutrition?
Yeah, thanks Rashmi, and thanks to Axis Bank Foundation for giving this opportunity. So, as you have very rightly said that Prasari has been working on livelihoods and water, to be very specific, like thematic areas of income security, water security, and the third thematic area of nutrition and hygiene security has emerged over a period of time. So while working with the community, so it took a little time to define specifically our customer. So the customer, initially we started working with the farmers, then we shifted to the household, then we shifted to the women as an individual, and then finally we came up together as a group of 10 to 12 women to live a life of dignity, is the statement that Prasari works with. So if you look back to the 4 arrows of development or the livelihoods, so that talks about the increasing the income and the employment, whereas the reducing the expenditures on on different expenditures and also minimizing the risks. So if you connect this livelihood intervention with this, so whatever the income you are generating, actually there are 2 other factors which is actually going out as an expenditure. So interestingly, that has come, we had 2 different backgrounds to overlay this particular layer onto this. One was that we have a typical traineeship program where professionals from the universities, they do join, spend 6 months right in the village, do the village stay and village study. They come back with their studies and come up with a detailed income expenditure statements of the households they stay with. And that significantly has soared over the years, that there was a roughly 20 to 35% of the out-of-pocket expenditure for the health issues for the families they are staying with. Now, as a sensitive citizen, you cannot stay yourself blind. No, there is a repeat hint of that particular data. So then when we came back to the community, and then community, we together emerged with 4 different modules to work with. So the very specifically, the groups, they talk about Atmanirbharata ki aur yatra. So in their Atmanirbharata ki aur yatra mein, so the group, they talk about a whole ecosystem of the services. The ecosystem of the for the livelihood services, ecosystem for the health services, and ecosystem for the education and other services. So what we do, that we have a typical framework that we call it as a kind of a magic train. The train has the connected compartment in terms of different ecosystem exists in all 3 levels, intra and inter-village level. And the train typically runs on a gender track. So it's typically the women that we work with, and there we have the catalysts in terms of our teams and the community resource persons whom we build. So when we went back to that definition of Atmanirbharata, so that specifically talks about the income, as well as that also talk about the women's aspiration on their health and nutrition as well. Education was also a component which we tried to match it up, and we really didn't fund much of our strength, that we have different strategy to deal with. So then we started exploring that what is our strength. So while exploring our strength, we keep on managing the water resources, rejuvenating the water resources, enhancing the supply of water for farm livelihoods. And eventually, what we could see that the farm products the households are getting, typically they have all the macro and micro level of supply of the nutrition. So we have typically done a typical arithmetic of supply of the daily value and the nutrition for a household. So we calculated the values of the calorie needed for that particular household, the seasonal index the households are having, and what is the contribution of macro and micro elements of nutrients with respect to the standards. So we calculated the deficiencies for the households in each seasons in terms of the food intake they are taking. No? So then we had the strength of promoting agriculture. So what we concentrated on, see, to supply this, to counter this deficiency of the nutrient supply, why can't we grow that particular crops which essentially meant for prevalence of that particular nutrient? So we started promoting the household-based gardens. It's not a typical kitchen garden. We don't call it as a typical as a kitchen garden. So it's the nutrition deficits that's being worked out using a typical Excel sheet for a household that gives you the balance sheet, the deficits of the nutrient for that, and the corresponding crops that household can be promoted with the households. So we work in diversified agroclimatic zones. So Meghalaya and Darjeeling, they are the Himalayan areas which have typical other crops and the deficiencies. We have the Central Indian Plateau zone where the plateau has a different deficiency. We also have the coastal zone interventions in West Bengal. So based on that, the crops are being selected which can suffice the nutrient deficiency that family is having. They started measuring based on the M&EL system managed by the community. They put on tally marks what they have fed based on a pictorial calendar that they have been given, and they can estimate that what was actually needed in terms of nutrient that they need and kind of supply they could ensure out of it. So this is how both our strengths got integrated, our interventions in the agriculture and water got integrated, and also the nutrition section that automatically emerged out. So this is how, thank you.
I think very beautifully explained by you. So I think the transition from farmer to household to women to a group of women who formulates their own vision, the nutrition vision, I think that was really beautiful. And I think what you said is that you build on your own organization's strength of working on water and livelihoods, where you know that how the crops needs to be grown. So systematically you looked at the nutritional requirements, the supply, and then accordingly map those things. So I think well said. Let's come to Indrani. Indrani, Cine from the beginning has been focusing on this issue of health, malnutrition, and then actually enlarge scope. And we could also see there was a change in the strategy or the framework I think in around 2014 or so, and enlarge its scope. And now we are also working with some of the partners like Pradhan and Harsha, where layering of livelihoods and health and nutrition. So how do you see this nexus of livelihoods and health and nutrition?
Thank you, Rashmi, and thank you, Axis Bank Foundation, for giving us this opportunity, because all of you see this is really, I mean, like we are speaking in different forums, but what actually is happening in the field. So for that, I think this panel is very important. Yes, you are right. We started with malnutrition and with a small clinic, and our founder, you know that he's a doctor, but he didn't open any hospital or kind of that. So we were in the slums and villages to identify what are the issues. At that time, malnutrition was really very prevalent. We started from that, but you are right. We eventually felt that if we want to address the malnutrition or other health issues, we should integrate education and child protection programming in our own journey. So we started in urban areas, child protection, and then rural areas, health and nutrition. So since last, almost I think we started 50 years back in 74, but still 90s it was like, rural and urban differentiation since program. So that time we were also working in silos, you see. But after almost 25-30 years, we felt that one is that convergence is very important, and second is that there are many, because we started as service delivery organizations, we were running clinics and identify NRC, you already mentioned, so giving food to the malnourished children, kind of that. But after 2000, many government programs have come up with full of resources, like National Health Mission, then Sarva Shiksha Abhiyan, then child protection programs. So though we started, health workers in all the villages in where we were working, we, analyzed that from government side, there are 25 workers from different sectors are working in the field, health, then education and others. So why should we duplicate the services? So we shifted our, approach, and that is the paradigm shift you are saying. We thought that we should play the facilitator role because that is very much lacking. There are government services and there are communities, but the community, they don't know what they can get from the government free of cost, and government also, because they have different, barriers that how to reach to the last mile. So we are, playing that role now, and another shift is that that time also panchayat in rural area, urban area also definitely, but in panchayat also, they are getting, after 73rd amendment, they are getting power. They have that authority to monitor the health nutrition programs and others. So we were building our programs around three critical, stakeholders. One is panchayat or local self-government. Another one is the service providers at different levels, mainly at the grassroots level. And third one is family and self-help groups. So, these, the organizations, community, institutions, we thought that they are the vehicle, and these three actually groups are the change makers. We can definitely play the role of facilitator, but if CINI is not there after 3 years or 5 years, they can take the, this learning forward. So that was the paradigm shift in our own, organization, and that's why this nexus, yes, I like the term, is very important to us as an organization as well as an individual, because probably Saikat and Ronak already said that yes, there are livelihood programs, very successful programs, but malnutrition still persists. So how to collaborate together? And for that collaboration, yes, we have little experiences. It was around many years back, 10, 12 years back, there was a Government of West Bengal program called as CSCMI, Community Healthcare Management Initiative. That was a very unique program, joint initiative by the Health and Family Welfare Department as well as Panchayat and Rural Development Department, where SHGs were trained on health nutrition issues, and they were doing the social resource map, they were tracking the children and adolescents and women in their own area, and they are how can I say, reporting, not reporting, but they were in dialogue with the health nutrition service providers. And initial days it was very interesting because one ANN, she was saying that no, in my village it is 90% immunization, and that SHG Didi, she was saying, see, I have all the names. This child is out of immunization, this child. So, and then it has come out that only 50% immunization has been done in there. So that's why these community institutions are really, very strong vehicle to, this type of, health and nutrition layering in their own work. And as, also we, our programming area-based approach. So when we are getting a fund from a donor on health and nutrition issue, we try to convince other donor to give fund on education or child protection in the same area, so that we can, see the outcome, maximum outcome. And in that time, when we are working with the young people, mainly young people, young women, so that time this layering was very much important for us. We had some programs, and we were linking these young people with the different organizations. We were giving this vocational training or linking them with market, but that was not in a very high scale. Then CSMI program, we started that is health nutrition layering can change the status of the village. And then another program came after this, which was TRI, Pradhan and Sini. That was a program in a very, very hard-rich area of Bankura and Purulia districts in West Bengal. I have 1 minute. Yeah. So you just let me know. So there also found that is these SHGs, then these like other livelihood institutions, if we can work with them and if we can train them, build their capacity on these issues, just learning in their own work. It is not that extra work they have to do. So that really giving a very good outcome. And as after 50 years also we want to we love to present us as learning organization. So really we want to learn from the partners here, and in the morning session also we heard from Sheila Ben that learning by sharing. So that's the most important tool. And the interplay between these issues like this income generation, wealth creation, then health seeking improvement in the health seeking behavior, and then enhance life well-being. So that actually is very important for us as an organization. And and also before this in last few weeks we did some convergence meeting with the livelihood partners in West Bengal, Jharkhand and Odisha. And so many possibilities have come up. If we work together, how can we bring the changes in the so that real and many very practical doable things the team has identified. So I think we are beginning with this. Definitely 2 years. Within 2 years, last 2 years, we are partner of almost 2 years. We are partnering for this program, the project. But I think from this year onwards, we will do it more structurally. We had a discussion with Harsha Trust, with Prasari, Pradhan, that how can we take it forward, and I think we have started that. Thank you.
Thank you so much, Indrani. I think it was good to know that how CINI as an organization has evolved over the years, like initially by doing itself, the clinic, setting up the clinic, and then collaborating with government, and then panchayats, involving panchayats. I think so it's an evolving journey. And then you highlighted the importance of working with community institutions, working very strongly with them so that they come out with their own plan and monitor the things on the ground. So I think, yeah, well said. I think let's go to the second round on getting deeper into the how part, deeper into the approaches, what worked, what did not work, what you're doing, is it really sufficient? I think let's think about that. Let's begin with Saikat. Saikat, I heard you saying about you looked at the nutritional requirements of the households, the women specifically, and then the households, and then map it and then build on that. Do you think that this approach is leading to some outcomes, some changes? How is it working? What has been your experience so far? And do you think it's sufficient, or are there factors, are there interventions required to be integrated?
Yeah. Rashmi, first, I'd like to say that this intervention has impacted to a large extent to the linear way of estimating that what the deficit was, and after 1.5 years of intervention, what exactly has happened, and happened in terms of available supplies of the nutrient, then performing the medical tests at the baseline level vis-a-vis the test at the midterm, and also the sharing in the groups that how they feel like that, what was the impact. I mean, it's a social audit in terms of the impacts being created. But yeah, so there are a number of evidences where like the coastal delta disconnected delta of Sundarbans. So the Didi says that I have practiced this. This is my calendar for the last 1 year. These are the tallies that I have done. These are the tricolor foods that I have practiced it. And for the last 1 year, I have not taken my child to the hospital or to the doctor. So there are several indicators of, even some medical indicators of your, the impact of the nutrition and it's very visible on the women and the child, right there. So that has created the impact in terms of supply of it. But there are many things that which we really don't know. That is not our area of expertise. So we need to, the ecosystem I was talking about, that partnering with the magic train, that's a dynamic train that moves on and stands on a station where the organization like Shini is there, who is having a lot of health experiences and expertise. So where it further connects to that, to build that particular ecosystem for the service by the catalyst directly to the community. So there are many things that we have to come across. So we standardized the practices, getting the records, which is little tedious for the women to keep track of it at the end of the day, what's they cooked and what's they fed to a family, and then converting it to the nutrition values of it with respect to the daily value and the calorie being fed. So it's little tedious that we could found, and so that needs some more improvisation on it. That can be much more simpler way that can estimate things. It's a typical ways of keeping records of it, which can be improved further. So the idea is well, because it was generated together along with the community, that what we can do. It's not only our strength that we talked about, it's also the community's strength on that way, and together we emerge for different agroclimatic regions, the models are. And but there are many things that there is a scope that we can do much better in this. That can bring, significant changes altogether.
I think wonderful to know that. I think in a very short span, like within 1 year, you are saying that we are getting the results. And perhaps since the community is, say, involved from the beginning, and the plan was a kind of a joint plan, I think perhaps that has led. But see, what I have seen that, I'll give an example of Orissa. What we have seen that even though the nutritious food is available at in hand at the doorstep, it's available, but the pregnant mother is actually not allowed to eat. After delivery, the mother is allowed only to eat rice and salt, no pulse consumption, no vegetable consumption, because of social taboos and customs. So do you see such kind of a thing on the ground, and how do you deal with that?
Yeah, it's very much there in Kalimpong that Sini and Prasari, they're working together on this. So that is an area, because Sini has all typical all the parameters of with respect to for the mothers and all, and then so that has a direct link with the intakes the mother actually is consuming. So because that has a direct it is quite visible in many times. But more you get engaged with the SHGs, creating a space for the woman as an individual and the group in her family, in the village, in the society, and in the larger ecosystem. We see it more of a creation of a space for women, the legitimate space that gender gets out in her the whole micro and macro ecosystem. That is more important, where she is very important, because so they are familiar with the name of somebody's mother or somebody's wife. So coming to this SHG, she has her own identity, and then gradually she creates that space, and that women has a value, and very significant value in the society. That matters a lot. It's not a kind of a standalone kind of parameter if what mother is taking or what mother is not taking. It's more of a space that we see it as. For the
Community as you said, the community institutions play a very important role. Let's come to Ronak. Ronak, what you spoke about Seva Mandir's approach, what I learned is that Seva Mandir actually tried to work around the entire spectrum of safe drinking water, reducing the drudgery for women, her own health, her own nutrition, child care, so your balwari, your schools, then the food basket, the entire livelihood. So then it seems like an entire spectrum that Seva Mandir is working. What has been your experience? How is it working? What worked? What didn't work? What more needs to be done?
So, when I said we work on various spectrum of work things, we have a few activities or areas which we selected as a kind of a core cross-cutting thing, and then few were based on the respective needs. And we don't do everything, we can't do everything. It is more of making that ecosystem approach kind of understood in the community itself, and then they pick it up. But the core areas, what we picked up was collectives, self-help groups, and we also have been forming institution called Gram Samu, which is a VO, community organizations. So these institutions has been one of the center work, and I'll share how it kind of, but they take so they have been the discussions around ecosystem building in the communities and looking at this holistically, a lot of discussions. I think you have to since been morning you're talking, we don't do everything. It's more about enabling them to pick up things. So if we share this idea about if you want to do livelihoods better, if you want to earn more, you need to address these issues in your family. Then if a woman has to work in a farm, she has to save her time. She has to be healthy. Her child has to be healthy. So I think this concept was one important strategy for us to kind of deliberate at a continuous level, and it's still been going on. The other common part was childcare services. I think we clearly understood that women in villages have too much of work, and I think that has one of our data, which now 3 years we just did our assessment of our one large intervention going on in about 300 villages. 34% of the women, like children who are attending Anganwadis or Balwadis, 34% women were able to work in Narega, additional to her work in farm and homes. So her time which she was giving for the child care at home was saved. So Anganwadis are for 4 hours. Most of the time we know they hardly work. So one important work we started doing was at least make the Anganwadi open regularly and motivating the workers and working with them. A lot of work on Anganwadis itself, increasing the efficiency of efficacy of Anganwadi, making the worker capacitated, but also being helped by women in the area. So 95% of Anganwadi, we started about 8 years back, only 35% of the Anganwadis in those villages were found open in a random visit. As of today, it is 95%. So that 4 hours is kind of spared for women to work more, or at least get relaxed also, not work every time, but at least she's taking some rest. So that was another area which was commonly done across all the part. And the third was food habits and nutrition, gardens and recipes. And largely how do we diversify and add on what they are already consuming, not bring anything from outside. The only thing we introduced or we revived in that area was millets. This was a millet growing area, and which the millets have been kind of went away. Livelihood helped us to bring millets back, because now it was a market pull for farmers to grow millets again. It was not for nutrition, but they started growing millets because they know that they can sell now millets outside. And because of that, because they are growing now, they have started eating it again in the homes. So that that was also another cross-cutting thing, which and along with that, kitchen garden or what nutrition garden, we call it sensitive agri farming. So that's the way we've been doing. So these three were common. Rest of the things were based on the local needs. So some places we been told that we have to go and go very far in the house for us to get fuel wood. So can we start promoting alternative cooking options for them? So Seva Mandir does have another intervention, but we also started telling them go and approach LPG, or the institution started working on them. We have a lot of work on common lands. So where the fodder was a problem, okay, bring another donor like Indrani told. Okay, we work on the common lands and help them to restore, or work in Narega and help to restore common lands. So these were like picked options where what is needed in the village. So I think one important learning for us was we need to design an integrated approach. It cannot come on its own. And if you look at it as an ecosystem approach, I think we can design it in a common way. And like very interestingly, we have some numbers after 4 years now. The villages where we work, the income, kind of 35% of the families who were earning 85,000 rupees, we took that as a cut-off mark. Now 78% are earning 85,000. In the same area, the vasting had gone down from 30% to 25%. SAM children, which is a severely acutely malnourished children, has gone down from 16 to 9%. And exclusive breastfeeding increased from 47 to 63%. So we are monitoring this data together in all the villages, and we're trying to see if these are changing simultaneously or there are still gaps in that. And just on the last point, what Saikat, I think it's true that this behavioral change is one area which we need much more longer time. I think our studies shows that 85% women know that they have to start breastfeeding within 1 hour, but hardly for less than 50% follow it. And these are, so one interesting experiment we did, and it has been very successful, is start doing Saas Bahu Sammelan. Mother-in-laws and brother-in-laws ko saath mein bulaye and talk with them. I think the major decision maker in the family for child nutrition is mother-in-law, not the mother. So converse with them, and I think that model, activity has been quite successful for us.
Yeah, I think lots of good points that have come up. I think your the way that you're keeping the data, I think that is really giving you a sense that how this livelihoods income that is being enhanced, and with this integrated approach, whether it is resulting something or not, I think that has come out very, very clearly. And I really like the idea of your Saas Bahu Sammelan, so very true. I think let's have some question at this point of time, and then we can have further rounds of discussion. Yes, please. So many questions. Yeah.
Comments or ideas.
Yeah, comments and ideas. Yeah.
Who's Rashmi?
We can start with Ananya.
I would like to ask you about some of the challenges we face. We work with women in agricultural value chain, specifically tea estates. And two things which are really big problems. One is access to sanitation. Another is menstrual hygiene management, which is leading to a lot of absenteeism. And because they do not lack access to sanitation, they have a lot of UTI and ultimately kidney and all the diseases which we mentioned. So in agricultural value chains is a problem because I think pan-India, so what is your take on that, and whether you are experiencing any of you, whether you're experiencing this challenge?
So, like we have our work typically in the tea garden areas in North Bengal, in Darjeeling and Jalpaiguri and Alipurduar area. So, what is that that's a very serious issue. The tea garden workers, so they don't they work all throughout the day. They join at 7 o'clock in the morning.
I know the problem. What could be the solution?
Yeah, so our agriculture intervention is not essential in the tea garden area because tea garden area do not have the agricultural land to produce enough of the agriculture produce.
No, I'm talking of tea as agricultural commodity. So it's a value chain, right?
Tea value chain that you are talking.
In any farmland, there's no
Yeah.
toilet, right?
Yeah, that's
And
no
that
doubt.
is hampering the health of even any farm.
Yeah, so that we are working on a mobile toilet concept for the tea workers because so that's a temporary toilet in the tea garden. So we have been talking with the Tata Trusts to come up with that maybe some design exists, but we are yet to. But that's a big concern that we are dealing with. So nothing much has
What
happened
about
yet.
cotton farming and other? I want to learn from other agricultural value chains. Is there any solution?
This is a big problem. There are no immediate solutions.
Yes,
So
I think this is a
in
huge issue.
Aligarh also we did a survey. A huge amount of uterine challenges coming from the sprays which are happening in the agricultural field. So even the medical system is also involved. Actually, this is coming to light only recently across multiple places. There are no structural solutions because pesticide companies are involved. So unless we create a body of evidence which clearly pegs the the challenge being related to the chemicals which are being used in the field, without that to challenge it legally is quite complicated.
Even to take steps in terms of prevention, that.
So,
Yeah.
Indrani, maybe that's an area where you should start looking at, especially in very intensive agricultural belts. This is a new issue I'm hearing across multiple places. The agriculture farm labor.
Actually, we have started a discussion in Assam, not in West Bengal, in Assam tea gardens, because the issues you are saying is not only health, even toilet is not there. So this is also, we can see that this is also gender-based violence kind of issues are coming up. So those are very, important to, address immediately. Unfortunately, very, very few donors and organizations are working on the menstrual hygiene and health. That is also very important. So yes, we are also discussing with different donors because it is no one-stop solution is there. But if, we have in this room, even outside also, we have different expertise, So Anirban is right, we have to, and in Assam we have started dialogue, definitely in West Bengal we can do together.
Yeah, thanks. Pradyut, and then we can go to Anirban and then Pradyut.
I wanted to ask Saikat or Ronak can explain about the nutrition gardens. So, what is your experience about the continuity of the nutrition gardens beyond the project? Because many times we have also in our cases we have seen that when you give the kit, the seed kits and the other say vermicompost, the package, the farmers are adapting. But after say maybe end of the project cycle, the farmers are not adapting. Similarly, at the same line, during the monsoon season, so nutrition garden in our case in Assam, other parts of Northeast, we have seen that during the Rabi season and early summer, people are doing this thing as a cultural thing. But during the monsoons period, which is very prolonged period from June and towards almost October, then because of the heavy rainfall, we have around 3,500 millimeter rainfall. Then the homestead lands are almost vacant. So what have been your experiences on that?
So Pradyut, I'll respond to you. I'll take you along to the earliest intervention area where for the 7-8 years the nutrition garden or nutrition concept is working with the mothers there. And initially we made a very, we don't have invested much in this. There was hardly any kind of project investment out of it because we mostly banked on the resources that they grew, kind of crops that they practice, and then there was a blanket 21 crop kind of, so for the Sundarban model I'm talking about, 21 crops that they were told to be practiced in their home states. So this is one. So there's not much relationship with for the input kind of funding out of the project for the promotion of the nutrition garden. It's awareness one that was some of the, because it's the SHG platform and the CLFs that we have used for this particular dissemination of this the idea of nutrition and intakes, how that can ensure to manage the deficits. And for the high rainfall area, yeah, Sundarban that experiences submergence and all. So there were monsoon, growing a crop in the monsoon is little challenging, of course. And we in some cases we used this gunny bag models, tea garden models. Like one household is having like 34, 35 gunny bags on the elevated part of the walls where they grow the creepers and other crops. Even that has been designed for that, which is a safe place to grow it, because that has an elevated till that the water level doesn't reach. And even in the tea garden area, so specifically they don't have the homestead level. So where we have used this gunny bag concept, like you have 50% vermicompost and 50% soil, and then put in the seeds of the crop that feeds you the desired nutrition. So this is how we do it.
Please go on.
Just to add here, we have not under this foundation funded program, but we have very good, experience on a different adolescent programming where we link this issue with the Gram Panchayat development plan. Because adolescent girls and the families, they are planting seeds, but after some time they are also losing their interest. But the panchayat is taking up now, because they have given the fence and each and every adolescent girl, they are taking care of one plant. So those type of, and we are not there, but still it is continuing.
Yeah, please. Please go ahead.
I think Pradyut's point on nutrition garden, I think it's the success comes at a very long time, many years. We have many failures in the initial years. Lagate the, agle saal nahi lagaya. But I think we kept trying and learning what happened. So I'm saying that very recent last year's data I can remember, but not the long one. First time we found that across our area, 1,800 families planted on their own. So I think they've started moving in that.
Did they have to give any inputs or trainings or anything?
No. They were trained in the past, previous years. So same areas we kept doing, but I think separately from giving your collectives, you keep talking. So not to stop that conversation where आपने लगाया था क्या हुआ उसका वापस लगाया कि नहीं लगाया. Just kind of. The second thing which helped us was to look at as a village economy. So vegetable cultivation at the commercial level were started in those villages through livelihood intervention. So if they are not growing also, they started consuming by buying any. They are buying from the village itself. So consumption of vegetables have gone up in the families.
But in our cases, we have seen that while the vegetable cultivation as per the livelihood program has increased, the intake by the women and the adolescent girls has not been directly proportional. So the selling has increased.
So that's actually the biggest drawback of livelihood program. We have learned. First talk about consumption and then talk about sales. And our indicators of only looking at sales is definitely, so integration then helps us to look, so some of the data I just got, so poultry ka data hai hamare paas. So poultry's data of last 6 months, families, what number of families I don't remember, but the data is 7.5 lakh ka murgi aur anda becha, 8 lakh ka khaya. So we capture both the data. We ask them, घर में दोनों क्या हो रहा है? What value of, how many anda then convert into value? So I think that circle has helped that, okay, आपको सिर्फ बेचना नहीं है, खाना भी है. And so that integration helps in that form. But it is a challenge. It doesn't convert that easily. One of the दूसरा पक्ष में ला रहा हूँ जो selling में आता है is many of the farmers started shifting on soybean in our area, which is was because of climate change. जो आपने बारिश का कहा, maize is not growing now, so it's doing soybean. Soybean is highly fertilizer and pesticide crop. So what it tells that okay, हम हमारा मक्का maize उगा रहे हैं घर में खाने के लिए without chemical, ये तो बेचने के लिए. So that is actually another problem, which is a moral agriculture now. That what do we do with this? It's a new question, that what are we doing for selling and what are we doing for consumption? They are able to separate it out.
Yeah. Just last question. Yeah, please. Anirban will come back with the second round.
Yes. So this is basically a kind of community practice which goes with the proposition of health and nutrition in livelihoods, and meditation from Dan Foundation. So here the community institutions which are in rural areas, they face like, you may also agree that for a poor family, the expenditure towards health and education is very immense. And when they spend more on that, then they fail to invest on the livelihoods. See, the committee has come forward to come out with a new product. In fact, they pay 300 rupees from each family in a federation. And the federation will be having around 3,000 to 4,000 members. Put together, it will be coming around 10 lakh to 12 lakhs. This will be sufficient for them to run a primary hospital on their own. And they pay for the doctors. And each member, n number of time, they can go and then take the service from doctors, and then all this prescription, everything is available at free of cost. So because of that, they are able to address their the kind of expenditure towards health. They could save around 60 to 70%, which in turn goes for livelihoods investment. That is one of the things that they are running. In fact, 10 secondary care hospitals are being run by the community, and around 100 primary care hospitals run by across the federations at national level. This is one practice which is running. And the second one, as already discussed, the prosumer concept. Basically, the producer has to consume. In fact, there is an unwritten declaration at village level and then institutional level. Each family has to consume minimum 5 kgs of millets, what they produce. And in fact, they are also having track. So that when they have more millets, nutraceuticals and fiber content is added, obviously it has a good impact on their health part. That is the second thing. And the third one, health insurance. And when they become the member of the federation and all, because that also another important area, and it's mandated that everyone in the family has to cover in the health insurance. And since the scale is very big, the institution itself is running, there is a separate vertical called People Mutuals. And they are also operating their own insurance, which is unavailable in the market. Probably the members who are having more than 60, the costs will be high and they cannot cover health insurance. But here it is possible. And that way, upon the scale it is running. Above all, there is a kind of peer pressure that when they go along the federation for about more than 5 years, there is a mandate that the adolescent girls from the family has to become a member as a separate track. Like they also promote the kind of adolescent groups. So far around 3 lakhs adolescent groups had a journey for the past 10-15 years. In fact, they entered here by the age of 10-12 and now they become a mother and then the children itself goes for school. That way they are running. Here, the adolescent girls are given with 2 responsibilities. One is, once they join, they are given with the responsibility of taking care of their nutrition garden. They have to promote, and whatever vegetables comes out of, they have to eat. And another one, they have to monitor their anemia. And interestingly, every year on Foundation Day, which falls on 2nd of October, they make a declaration that they came out of anemia. Because they are making a track of their anemia, how far they are coming out of that they declare. So that becomes the source of inspiration for the rest of the group, adolescent and maternal mother, as well as the larger community, to have a look on this health and nutrition in livelihood sports. Thank you.
Thank you, Mr. Venkatesh. I think a lot of good initiatives, be it your health insurance, running hospitals, community institutions running hospitals, nutrition garden, adolescent girls. I think so. A lot of good initiatives and great to learn from Dance Foundation's experience. So let's come back to this panel. So specific questions to Saikat. As we began that we said that Prasari is a hardcore livelihood promoting organization. So, and in this forum, a lot of livelihood promoting organizations have come. What specific challenges that you faced while integrating these two aspects?
Yeah, so let me share with you some examples of our annual retreats. So in every retreat, so that's a pool of 60, 70 professionals where all go back and reflect the thematic interventions that as an organization we have done. And a couple of years back we had a serious discussion, are we really taking this nutrition and the hygiene forward or we are just dropping it out? If we are dropping it out, let us delete this third thematic area that we state in our organizational documents. Because it was very specific to some very pockets. This was not actually coming aligned with the people rigorous intervention and the people are rushing for the promotion of the livelihood or integrating water resource management into that, and or is smiling. So that was nearly not picking up. So we actually again we started looking back into it, and because this was very easy, little easy for us to the extent that we did, integrating the nutrition component into that. So that is one of the challenge because you have despite you being built on the teams based on the institution, converging multiple projects, yours is not a only project funded teams, but still there are project targets and the pressures, the numbers, 60,000, 70,000. So that often, which are voluntarily supported and unprojected items that often gets little lesser priority. So that is one of the challenges that internally your 6 monthly review that keeps track of it, but it might need often little further track to keep it alive. So yeah, so you have to be very patient and patiently monitor that whether the alignment is being done. So that we had to do with all our teams, and if the cluster meeting is getting that agenda at all, reviewing some of the cluster meeting agenda, that how things are stepping up, nutrition is getting included into that. So this was some of the things.
Thank you. I think I ask this question because often when we are the livelihood promoting organization, there's a particular rigor to livelihoods. There's a particular intensity. So when we are into that rigor, and when we are doing that value chain, market, all that stuff, it's a different ballgame altogether. And whereas nutrition, on the contrary, or health, on the contrary, requires patience and case-by-case management. So there are two different set of approach or say perspectives that are required, and perhaps the skill set and the kind of people that we have on the ground, sometimes it becomes difficult for a livelihood promoting organization. That's, I just added from my side, my own experience in that. Yeah, let's hear Indrani. So Indrani's CINI has been working with government. CINI's own experience on, say, identifying the high-risk pregnancies, the SAM, MAM children, the underweight children, working with government, the ICDS and health department very, very closely, and bringing that systemic change that CINI is working on that front. How has been your experience with working with government? And the same question will be to Ronak as well. Yeah.
Yeah. So when I mean, like shared that who you started, who you are, I mean, like serviceable organization, but we decided that we will be part of the government program and we strengthen our system. So as you are very right, there are challenges, but we as an organization, we see it as opportunities. Because why I'm saying that? Because we train government people, ASHA training, Anganwadi training, we do that mainly for West Bengal. And also when I mean like there are quality of services are, quality services are not available at the grassroots level. So we, thought that is also our failure, or kind of that. So it is not only government services, but also I think it is a joint type of, program planning should be there, and also, when we call it advocacy, we are not, doing it with Chanda. So we sit in the same table and we say that these are the challenges we are facing at the grassroots level, and please let us, solve together. So that's our experience with government. Definitely not in all the states. This is the issue, because we started in West Bengal, so we have 50 years of legacy, 50 years of partnership with the government. In new states, yes, we are facing few challenges, but the issue is that as we have a structured program intervention implementation manual, and as well as a training manual across all stakeholders. So we go with that and we say that, see, this is our learning from the 50 years from the grassroots level, and we are still in the grassroots, and we are also here to not to we can't say government to help, but to solve the problem together. So let us plan accordingly. Let us have a joint plan, joint monitoring, kind of that. So very recent example that in other one of the other programs that we are finding out in West Bengal that maternal nutrition is really a challenge, and which state also wants to address. So we did a joint planning kind of that because that program is not across all districts, but we could convince the state government that it is a issue across all the districts, and also along with the teen pregnancy. So how we can solve that? So they organized training of all of their district and block level people. Sini was there as a supporter, and also the training was done by the technical people in the state. So that type of collaboration, and I think it is very positive from our side.
So staying grounded, but working very closely with the government at the local level, it's really essential.
Yes. And also we, just to add that always we not only, speak. So we take the adolescents from the field, we take women from the field, so they share their own experiences with the state government, so directly. So that also, convincing them, to understand, yes, and also we are, since last few years, 4 or 5 years, we are investing in our own organization development. So how to build more evidence-based documents, so that as Ronak was sharing, that yes, we are investing in livelihood as well as nutrition. So what is the result? So that results-based framework, we are working very seriously since few years, and we have established one Cine Resource Center, that is the R&D department within Cine. And with the technical people from different verticals, we have developed, we call it is a method to turn rights into practice. So that we continuously promoting to the government, but our foot is on the ground, and we are taking voices from the grassroots.
Ronak, very quickly.
I think everybody here has worked with government, so the experience what we have would not be new. But our work has been very closely with ICDS department because of childcare services, and thoda bahut health department, I think, and I'm saying ICDS department has been very successful. Health department is work in progress, and the challenges, I think the biggest challenge first comes at the Anganwadi workers and Ashas. Their motivation is lowest in the system, and I think making them, बहुत सारे लोग training देके गए, आके चले गए, and I think what Pradyot told, like for nutrition garden, वहाँ पे भी वही हो रहा है. Lot of organizations, everybody is training. So what we focus more was on hand holding. हम training तो ठीक है, but our worker will sit with you in your center for 2 hours, help you whatever you do. In that process, build confidence about that you're doing well. And secondly, increasing her respect in the communities. Communities should also take the responsibility of running an Anganwadi. So that connect has been one important kind of work. The second one was building government officials' interest. And it's another long time. शुरू में जब हमने कहा, when we started working, it definitely interest was low. But when the worker starts telling that this is helpful for us and we are enjoying it, I think now we have reached to the level where LS and CDPOs को हम train करें. So Seva Mandir has been very concentrated in one area. So we bring project by project. We don't. Donors can change 3 years में and CSR है तो हमारे लिए next donor ढूंढना है. But we are not going to move away from that village till we reach to a level where it's a ladder by ladder approach with the government. And third success was panchayats. I think making panchayats, a lot of sarpanch has never gone inside an Anganwadi center. वो अपने गांव के center में ही नहीं गए होते. They don't know what is happening in that Anganwadi center. It's not their kind of role. So making that important. And I'll just give one indicator. In 5 years, we were able to get 681 Anganwadi centers rebuilt by Panchayat funds. So they brought money to kind of repair or rebuild and make it child friendly. We demonstrated few, they copied or they learned from that, and then so I think that's the three main experience. It's not health department is definitely difficult. I don't know why, but probably that's the doors are too little bit slow to open. It's more technical. That's also the one issue which we are not a health organization, so we find challenge to kind of interact with them much as an organization. But I think this has been a few important learnings.
Great. I think you spoke about this building the citizenship, like so the community demands the Anganwadi or panchayats are more aware and they are involved into the entire thing. I think and layering, going step by step. I think that's, you mentioned the key essential things in your approach. Great. I think let's go to the last question. So top 3 suggestions that you want to make to the other the organization or the livelihood promoting organization, that how do they integrate these strategies? Top 3. Yeah, sequence. I think let's first Saikat.
I was never first in my class.
Yeah.
So what I'd say that the kind of like anyone was talking about the MLEL. So the record and the data that we give, can we put in a nutrition and health lens into it? Because we do a lot of work that has a direct relationship with the health and nutrition indicators. The organization working on water resource management definitely works on the water qualities. It talks about electrical conductivity, pH, it talks about TDS. No, so that has a direct relationship with the health values. So lesser you have managed these parameters, you have directly actually impacted the health of the people who are taking that water as the drinking water. So same is with other livelihood programs and the agriculture farm livelihoods program that I know only. So that so kind of setting the indicators in your data recording template gives you an automatic emphasis without doing much categorically on nutrition. So that is one take that I do have. And even to go beyond that, if we can target the departments, government departments, they are working like somebody is working on the water resource management is actually contributing to the health aspects of it. So do their, so it's not only starting and finishing the job. So they also can, if that level of advocacy can create that kind of template to generate the data which is cross-cutting, interdepartmental. So we are not asking them to converge, which is very little task to bring the departments under convergence. But the indicators can give you the hint in that level of that scale of data.
Ronak?
I think I'm going to repeat the points I told. I think design for an integration. It has to be done deliberately. And second, long-term effort. Actions might break in between, but dialogue or through the collectives should continue. I think that is. And third, because it's very close to our child care services is a need for women in the village. It has to be strengthened in many ways, but also for livelihoods improvement. So these are the three.
Yeah, so three learning from our journey, so I just want to share with you. One is that the livelihood affects actually households, not the SHGs or collectives, because they are the vehicles of this. But the actual, the issues which are dealt by the SHGs or the other collectives, the loan, repayment, their income generation, all are actually affecting the household. Same health and nutrition programs that should affect the household. So I think we should focus more on the household level programming and mapping of households, and jointly we can do the analysis of case analysis type, because there will be 4 types of cases. One is that where both the organizations, livelihood and health and nutrition partners, were working together in one household. In another household, maybe no Amida partners are there. Okay, so without any partner. Third one may be health and nutrition programming there, livelihood is not there, and fourth one is livelihood is there, health nutrition not there. So in these 4 types of cases, how the partnership work well, and what is the implication in the outcome of actually the enhanced well-being at the end of the street. So that I think we should think through. After this joint collaboration. And second one is that our earlier experience and now also, it is showing that sometimes these SHGs, these community institutions, they have greater access or greater acceptance at the village level than the health nutrition service providers or kind of offers. So if we can do some structured capacity building training, hand-holding support, as Ronak said, with this collective, so that really work very well. For example, if we know the social issues, because CINI believes in the preventive model. So the social issues at the bottom level, so that is really well handled by these collectives, like preventing early marriage, sending the children into the schools, addressing the gender-based issues, which is actually affecting livelihood as well as health nutrition indicators. So if you can engage these collectives in an efficient way to offer the social determinants, and finally, pushing the health indicators, like getting 4 AMCs, doing the 100% immunization. So those type of issues are also our experience with the SHG groups is working very well in different areas, even in the hard to reach areas, where even ANM or ICS worker, they couldn't reach. So these two, this is the second one. Third one is that, yes, let's think together some framework, common framework of livelihood as well as health nutrition programming, and a few composite indicators, so that at the end of the journey we can measure, because separately we are measuring health and nutrition livelihood program, but jointly what change we could bring to a village which is really very much vulnerable in terms of different indicators. I think we can now think of that type of framework and indicators which have come up in all the 3 convergence workshops. So I think that is most important, and if we can do that, yes, definitely in the long run we can see the well-being of the community would increase. So we are hoping for the best.
Yeah, I think well said. So I think what you said about the household, keeping the well-being of the household at the center and looking at the intervention, designing the interventions, and there has to be deliberate effort in coming out with an integrated model. It cannot be an automatic thing. Yeah. And the importance of integrating indicators around health and nutrition when we are designing even the livelihood programs, will be really helpful for any livelihood promoting organization to start looking at that and then coming out with solutions. And that can happen even at the department level, what Saikat said. And the partnership model that is coming out, I think it's important to come out with a common framework so that we can see that how this partnership is leading to changes and how livelihoods and health and nutrition can be seen together. Yeah. Thanks a lot. Let's open the floor for questions. So let's start with Anirban, then the lady last. Yeah, Anirban. One question.
Time is up now. Oh.
Yeah, very quickly.
Yeah. One question I had was, we are discussing the very ground intensive efforts which we are doing. But there's a whole body of work which has been done on this. Integration of the health and nutrition with the community groups. Actually, Gates Foundation supported PFI to do a study. There were actually about 2 years back 105 studies which were done on this levy, and they tried to summarize what is coming out of that. And in that, the biggest summary was on certain dimensions, the community platforms are greatly helpful. So A, we should look at that because there's no point reinventing the wheel. Second is already because of these studies and efforts, there's a large-scale integration which has already happened. It has its own challenges, like the entire FNHW engagement with the NRLM. Similarly, there's a community outreach engagement under NHM. Then there are Poshan Abhiyans which are getting integrated with panchayats. So there is what I'm saying is, as we keep doing a very intensive work on the ground, but in the ecosystem, there are many things happening. So how do we bring in the lessons and learning so that we don't rediscover the same thing with philanthropic capital which is being put by Access Foundation? So that's my worry, and we need, especially the technical organizations, need to take it forward.
You want to respond? No,
Yes,
it's just a point.
comment.
Yes. Yeah, please.
But we agree with you.
Yeah, good evening. Myself Sevin and I'm from Gramvikas Odisha. I have a question like whenever we see interventions related to health and nutrition in the sector, we mostly focused on women-centric, right? Aren't we like putting an extra weight over the shoulders of the women, keeping them responsible for health and nutrition of their household or for the community? What are our attempts in the sector like related to health and nutrition, keeping men also responsible for health and nutrition? Why it is always women-centric? As much as I understand the social equations and institutions which the society we are in, what interventions or attempts are we making to keep men also equally responsible for health and nutrition?
Just to add, yes, it is not really women's, like responsibility in all our programs, at least in this program. We try to, engage as much as possible because also we had a study that male involvement in these issues. So we are, following the recommendations and we do it. But no, it is not so easy. That's also, yes, yeah. Even in adolescent programs, engaging boys are also challenging. But we are, trying to solve that at the local level.
Yeah, no, for us, that the platform you are typically engaged with for all your interventions, so is the typical women platform for specific to our case. So this is much easier to deal with the things. So women are taking they're taking the load with the kind of pride that they feel like, kind of dignity that they define. So there is nothing wrong in.
I'm not saying anything wrong in it, and I understand it is the easiest platform that we have access to, especially dealing with topics like health or any topics related to health and nutrition. I completely agree. When you mention that they are taking it with the pride, I agree they have the agency to take that decision. But still, what are our attempts and how are we trying to bring men also into the
dialogues and conversations regarding this.
So
I have never seen any successful
Yeah.
intervention related bringing men in this. That's it.
I won't be able to respond to you in detail that how many.
I understand, yeah,
And
yeah.
the only thing that I'd say that we get the males for 5 months in our villages. 7 months in general, the males are out for migration. So we have the custodians right there with their group of 9, 10 peers right in the village, women who deals all the issues or like agriculture is a male thing, but still they are doing. Water resource management is a male thing typically, but still they are doing. And they are also taking care of the health of the family. Yeah.
And I hope like all of us like keep this in mind like while we are deciding any interventions related to this. Thank you.
Just kind of, fact is that women are there, so we have to solve their problems. What we are doing, two things which we are trying as an experiment. One is talking with men for parenting. That's what we've started, because as we are going deeper into child care, at least whenever they are, try to get engaged. And at the adolescent level, we closely work on gender relation issues, and we're sensitizing the boys at a young age. तो काफ़ी जगहों पे हमारे ऐसे एक्सपेरिमेंट्स हो रहे हैं कि स्कूल के घर गांव में लड़के खाना बनाते हैं, लड़कियों को खाना खिलाते हैं. So those kind of gender roles शायद आगे 10 साल में कुछ उसका impact दिखेगा.
Yeah, I just want to add that even we, at our organization level, we also have the counseling done at women level, the family level, just not sitting with the women. So I think the men are very, very important, and also the village level meetings that what we have. So it's important to involve men. That's what we are making sure, that it's just not women and we are sitting with the women group, but it has to be, the dialogue has to be with men as well. Yeah.
Unfortunately, still the women are not the decision makers.
Yeah, they are not
so
the
that's
decision.
why.
Yeah. Thank you so much. I think so we had a lovely discussion. Thank you, Ronak, Saikat.
Thank you, Rashmi, thank you, Dr. Indrani, thank you, Saikat, and thank you, Ronak. Thank you for being a wonderful audience. I know we are slightly rushing on time because some of you have your flights, but what I can say is this conversation doesn't end here. There are a lot of things that we can learn from each other. I think I can think of many things just from hearing this conversation, how our cross-learning can happen, and definitely we'll do something about this. So thank you for being a wonderful audience. What I would now request is, we'll still request 10 more minutes of your time, and we'll request you to be seated here, as these two rooms will be opened up right now for a joint 5-minute conversation, and then we'll do one group photo outside in the lobby, and then followed by a meeting. Yeah. So thank you once again, and let's keep this sharing going. Yeah. Thanks a lot. Thank you.